Did you know that your kidneys filter around 50 gallons of blood every single day? These small but mighty organs work tirelessly to keep your body in balance, filtering out waste, excess fluids, and toxins. However, while your kidneys are busy performing these crucial tasks, some of the medications you take, often ones you might not think twice about, could be quietly causing them harm. This hidden threat can lead to serious and irreversible damage over time, making it vital to understand which medications could be putting your kidneys at risk. Kidneys are essential to your overall health, performing vital functions that keep your body running smoothly. These bean-shaped organs are responsible for filtering waste products, excess fluids, and toxins from the blood, which are then excreted as urine. Beyond this, kidneys also play a critical role in regulating blood pressure, balancing electrolytes, and producing hormones that manage red blood cell production and bone health. Given their wide-ranging responsibilities, it's clear that maintaining kidney health is crucial for your well-being. However, despite their resilience, kidneys are vulnerable to damage, particularly from certain medications that many people take regularly. Even common over-the-counter drugs can pose risks if not used correctly. When these medications are not properly monitored, they can impair kidney function, leading to acute kidney injury or chronic kidney disease over time. The purpose of this article is to shed light on the common medications that could harm your kidneys, often without you even realizing it. By understanding these risks, you can take proactive steps to protect your kidney health, ensuring that these vital organs continue to function effectively throughout your life. The kidneys are remarkable organs, performing several critical functions that are essential for maintaining the body's internal environment. One of their primary roles is filtering waste products from the bloodstream. Every day, the kidneys process about 120 to 150 quarts of blood to sift out approximately 1 to 2 quarts of waste products and extra water, which become urine. This filtration process removes toxins, excess salts, and urea, a byproduct of protein metabolism, ensuring that these harmful substances do not accumulate in the body. In addition to waste removal, the kidneys are crucial in balancing the body's fluids. They regulate the volume and composition of blood, maintaining the right balance of water, salts, and minerals like sodium, potassium, and calcium. This balance is vital for the normal functioning of nerves, muscles, and other tissues. The kidneys also play a key role in regulating blood pressure by controlling the amount of fluid in the body and releasing hormones that constrict blood vessels when needed. Furthermore, the kidneys are involved in producing essential hormones. They release erythropoietin, which stimulates the production of red blood cells in the bone marrow, and they convert vitamin D into its active form, calcitriol, which helps maintain bone health by regulating calcium and phosphate levels. These multifaceted functions highlight the kidney's importance in keeping the body's internal systems in check. However, the very process of filtering and excreting substances makes the kidney susceptible to damage, especially from medications. Many drugs, including prescription medications, over-the-counter drugs, and even some herbal supplements, are processed and excreted by the kidneys. When these medications are broken down in the body, they produce byproducts that must be eliminated. If these substances are too toxic or are not properly excreted, they can accumulate in the kidneys, leading to potential harm. This is where the concept of nephrotoxicity or kidney toxicity comes into play. Nephrotoxicity refers to the occurrence of kidney damage due to exposure to harmful substances, including certain medications. Some drugs can directly injure the kidney cells, while others may cause damage indirectly by altering blood flow to the kidneys or by causing an immune reaction that affects kidney function. Over time, this damage can impair the kidney's ability to filter blood effectively, leading to conditions such as acute kidney injury, AKI, or chronic kidney disease, CKD. Understanding how medications interact with the kidneys is crucial for minimizing these risks and protecting kidney health. Non-steroidal anti-inflammatory drugs, NSAIDs, are among the most commonly used medications worldwide, often taken to relieve pain, reduce inflammation, and lower fever. Examples of these drugs include ibuprofen, commonly found in brands like Advil and Motrin, and naproxen, known by the brand name Aleve. While these medications are effective for managing pain and inflammation, they can pose significant risks to kidney health, particularly when used frequently or in high doses. The way NSAIDs work is by inhibiting enzymes called cyclooxygenases, COX, which play a key role in the production of prostaglandins. Prostaglandins are substances in the body that promote inflammation, pain, and fever, but they also help maintain adequate blood flow to the kidneys. By reducing prostaglandin levels, NSAIDs decrease inflammation and pain, but this also constricts blood vessels leading to the kidneys. As a result, the blood flow to the kidneys is reduced, which can impair kidney function and, in severe cases, lead to acute kidney injury, aka acute kidney injury is a sudden decrease in kidney function that can develop over a few hours or days. This condition can be reversible if caught early, but it can also lead to long-term damage or chronic kidney disease if not addressed. People who are particularly at risk of NSAID-induced kidney injury include those with pre-existing kidney conditions, as their kidneys are already compromised and less able to cope with the additional stress caused by these medications. The elderly are also at higher risk because kidney function naturally declines with age, making them more susceptible to damage. Additionally, individuals taking high doses of NSAIDs or using them for extended periods are more likely to experience harmful effects on their kidneys. Given these risks, it's essential to use NSAIDs with caution, especially if you fall into any of the at-risk categories. Always consult with a healthcare provider before using these medications regularly and explore alternative pain management options if you have concerns about your kidney health. Antibiotics are critical tools in the fight against bacterial infections, but some classes of antibiotics can pose significant risks to kidney health. Among the most concerning are aminoglycosides, such as gentamicin and vancomycin, which are often used to treat serious infections that are resistant to other antibiotics. While these medications are highly effective at eliminating bacteria, they can also be directly toxic to kidney cells, leading to a condition known as nephrotoxicity. When antibiotics like aminoglycosides and vancomycin are administered, they are filtered through the kidneys to be excreted from the body. During this process, these drugs can accumulate in the kidney tissues, where they can cause damage to the cells responsible for filtration. This damage can disrupt the kidney's ability to effectively filter waste from the blood, potentially leading to acute kidney injury, AK. AK is characterized by a sudden decline in kidney function, which can result in the buildup of waste products in the blood, electrolyte imbalances, and fluid retention. In severe cases, AK can be life-threatening and may require dialysis or other intensive treatments. The risk of antibiotic-induced kidney damage is particularly high in certain populations. Patients who require prolonged courses of these medications, such as those with chronic or severe infections, are at greater risk because the longer the kidneys are exposed to these toxic substances, the more likely it is that damage will occur. High doses of these antibiotics also increase the risk, as larger amounts of the drug can lead to higher concentrations in the kidneys, exacerbating the potential for harm. Additionally, individuals with pre-existing kidney conditions are especially vulnerable, as their kidneys are already compromised and less capable of handling the additional stress caused by these nephrotoxic drugs. For patients who are at risk, it's crucial to monitor kidney function regularly during antibiotic treatment. Healthcare providers may adjust dosages, opt for alternative antibiotics with less nephrotoxic potential, or limit the duration of therapy to minimize the risk of kidney damage. If you're undergoing treatment with these or similar antibiotics, discussing potential risks and precautions with your healthcare provider is essential to protect your kidney health while effectively treating your infection. Proton pump inhibitors, PPIs, are a class of medications widely used to treat conditions like acid reflux, gastroesophageal reflux disease, GERD, and peptic ulcers by reducing the production of stomach acid. Common examples of PPIs include omeprazole, marketed as Prilosec, and esomeprazole, known as Nexium. While these drugs are highly effective in managing acid-related disorders, emerging evidence has linked long-term use of PPIs to significant risks for kidney health, particularly chronic kidney disease, CKD, and acute interstitial nephritis. Acute interstitial nephritis is an inflammatory condition affecting the kidney's interstitium, the tissue surrounding the kidney tubules. This condition can be triggered by an immune response to PPIs, leading to swelling and impaired kidney function. If left untreated, acute interstitial nephritis can progress to more serious kidney issues, including chronic kidney disease. CKD is a gradual loss of kidney function over time, where the kidneys become less efficient at filtering waste and excess fluids from the blood. This can lead to the buildup of toxins in the body, which can cause a range of health problems, including cardiovascular issues, anemia, and bone disease. The risk of developing these kidney conditions from PPI use is particularly concerning for individuals who take these medications over a long period. PPIs are often prescribed for short-term use, but many people continue taking them for months or even years without medical supervision. This prolonged exposure increases the likelihood of kidney damage. Elderly patients are at higher risk as well, not only because they are more likely to use PPIs long-term, but also because kidney function naturally declines with age, making them more susceptible to drug-induced kidney damage. Additionally, individuals with other risk factors, such as existing kidney disease, hypertension, or diabetes, may be more vulnerable to the adverse effects of PPIs on kidney health. Given these risks, it is important to use PPIs only as directed and to regularly review the necessity of continued PPI therapy with your healthcare provider. For those requiring long-term acid suppression, healthcare providers may consider alternative treatments or strategies to minimize the risks to kidney health. If you are currently taking PPIs, especially for an extended period, discussing your treatment plan with your doctor is crucial to ensure your kidneys remain protected. Diuretics, often referred to as water pills, are medications commonly prescribed to help the body eliminate excess salt and water by increasing urine production. They are widely used to treat conditions such as heart failure, high blood pressure, hypertension, and certain types of kidney disorders. Two well-known examples of diuretics are furosemide, often known by the brand name Lasix, and hydrochlorothiazide, which is found in several combination blood pressure medications. While diuretics are effective in managing fluid retention and reducing blood pressure, they can also pose risks to kidney health, primarily by causing electrolyte imbalances that may lead to kidney injury. The kidneys play a crucial role in balancing electrolytes, such as sodium, potassium, and calcium, which are vital for many bodily functions, including nerve and muscle function, and maintaining proper fluid balance. Diuretics, by their very nature, increase the excretion of these electrolytes along with water. This forced excretion can disrupt the delicate balance of electrolytes in the body. For example, excessive loss of potassium, a condition known as hypokalemia, can lead to muscle weakness, arrhythmias, irregular heartbeats, and, in severe cases, kidney damage. Similarly, significant loss of sodium can result in hyponatremia, which can cause confusion, seizures, and other serious health issues. These electrolyte imbalances can impair the kidney's ability to function properly, leading to conditions like acute kidney injury, AK. AKI is a sudden decrease in kidney function that can result from the kidney's struggle to maintain balance while dealing with the increased load of excreted substances. Over time, if electrolyte imbalances persist or worsen, they can contribute to chronic kidney damage, reducing the kidney's overall efficiency. Certain groups of patients are particularly at risk of kidney injury from diuretics. Those with heart failure often take diuretics to manage fluid overload, but the additional strain on the kidneys from these medications can exacerbate kidney problems, especially if kidney function is already compromised. Patients with high blood pressure, who may be on long-term diuretic therapy, are also at risk, as prolonged use can lead to sustained electrolyte disturbances that gradually damage the kidneys. Moreover, individuals who are on high doses of diuretics or who take them for extended periods are more likely to experience these adverse effects. To minimize the risks associated with diuretics, it is essential for patients to have regular monitoring of their kidney function and electrolyte levels. Healthcare providers may adjust dosages, recommend dietary changes, or consider alternative medications to help protect kidney health while managing the underlying condition effectively. If you are taking diuretics, especially for long-term conditions like heart failure or hypertension, It's important to work closely with your healthcare provider to ensure that your kidneys remain healthy and that any potential complications are promptly addressed. ACE inhibitors, angiotensin converting enzyme inhibitors, and ARBs, angiotensin I receptor blockers, are commonly prescribed medications used to treat high blood pressure, heart failure, and certain types of chronic kidney disease. Lisinopril, an ACE inhibitor, and losartan, an ARB, are among the most frequently prescribed drugs in these classes. These medications work by targeting the renin-angiotensin-aldosterone system, RAS, a hormone system that plays a crucial role in regulating blood pressure and fluid balance in the body. While ACE inhibitors and ARBs are effective in controlling blood pressure and protecting the heart and kidneys in many patients, they can also have adverse effects on kidney function, particularly in certain vulnerable populations. The primary way ACE inhibitors and ARBs affect the kidneys is by altering blood flow within the kidneys. These medications dilate the blood vessels, which reduces the pressure in the arteries and decreases the workload on the heart. However, in the kidneys, this dilation can reduce the pressure in the glomeruli, the tiny filtering units that remove waste from the blood. In some cases, this reduction in pressure can lead to a decrease in the glomerular filtration rate, GFR, a measure of how well the kidneys are filtering blood. For most people, this effect is mild and temporary, and the benefits of these medications outweigh the risks. However, in some patients, particularly those with pre-existing kidney disease, the reduction in kidney function can be more pronounced and persistent. Individuals with existing kidney disease are at a higher risk of experiencing kidney-related side effects from ACE inhibitors and ARBs because their kidneys are already compromised and may not be able to tolerate further reductions in blood flow and filtration efficiency. The elderly are also more vulnerable as kidney function naturally declines with age, making them more susceptible to the adverse effects of these medications. Additionally, patients who are dehydrated, either from illness, insufficient fluid intake, or the use of diuretics, are at increased risk. Dehydration further reduces blood flow to the kidneys, compounding the effects of ACE inhibitors and ARBs and potentially leading to acute kidney injury, AK. Despite these risks, ACE inhibitors and ARBs remain important medications for many patients, especially those with conditions like heart failure or hypertension, where they can prevent more serious complications such as heart attacks and strokes. To mitigate the potential risks to kidney health, it is crucial for patients taking these medications to have their kidney function monitored regularly, particularly during the initial stages of treatment or when dosages are adjusted. Healthcare providers may also recommend adjusting fluid intake or temporarily discontinuing the medication if kidney function declines significantly. If you are taking an ACE inhibitor or an ARB, it's important to stay in close communication with your healthcare provider, especially if you have any underlying kidney conditions or are experiencing symptoms of dehydration. With careful management, the benefits of these medications can be realized while minimizing the potential for harm to your kidneys. Chemotherapy drugs are powerful medications used to treat cancer by targeting and killing rapidly dividing cells. While they are often essential in the fight against cancer, these drugs can also have significant side effects on various organs, including the kidneys. Cisplatin and methotrexate are two chemotherapy agents that are particularly known for their potential to cause nephrotoxicity or kidney damage. Understanding how these drugs affect the kidneys and who is at risk is crucial for minimizing harm and ensuring effective cancer treatment. Cisplatin, a platinum-based chemotherapy drug, is widely used to treat various types of cancer, including lung, ovarian, and testicular cancers. However, one of its major side effects is its potential to cause direct damage to kidney cells. Cisplatin accumulates in the kidney tissues, where it can induce oxidative stress and inflammation, leading to cell death and damage to the kidney's filtering units, known as nephrons. This damage can result in a decrease in the glomerular filtration rate, GFR, leading to acute kidney injury, AK, and in some cases, chronic kidney disease, CKD, if the damage is severe or prolonged. Methotrexate, another chemotherapy drug, is commonly used to treat cancers such as leukemia, lymphoma, and osteosarcoma, as well as autoimmune diseases like rheumatoid arthritis. Methotrexate can also be toxic to the kidneys, particularly at high doses. It can cause the formation of crystals in the kidneys, which can block the renal tubules and lead to kidney damage. Additionally, methotrexate can impair the kidney's ability to excrete waste products and drugs, further exacerbating the risk of kidney injury. Cancer patients undergoing chemotherapy are particularly at risk for kidney damage due to these drugs, especially when high doses are required or when treatment is prolonged. The kidneys are responsible for filtering and excreting these toxic agents from the body, so they are directly exposed to the harmful effects of the drugs. Patients with pre-existing kidney conditions, those receiving other nephrotoxic drugs, and those with risk factors such as dehydration or advanced age are at even higher risk of developing kidney problems during chemotherapy. To minimize the risk of kidney damage, healthcare providers often implement protective measures during chemotherapy treatment. These may include adjusting the dosage of the chemotherapy drugs, ensuring adequate hydration before and after treatment to help flush the kidneys, and monitoring kidney function closely throughout the course of therapy. In some cases, additional medications may be administered to protect the kidneys or to enhance the excretion of the chemotherapy drugs. For cancer patients, it's essential to work closely with their oncology team to manage the potential side effects of chemotherapy on the kidneys. Regular kidney function tests, such as measuring serum creatinine and GFR, can help detect any early signs of kidney injury, allowing for prompt intervention. By balancing the need for effective cancer treatment with the protection of kidney health, patients can receive the best possible care while minimizing the risks associated with chemotherapy drugs. Lithium is a well-established medication primarily used in the management of bipolar disorder, where it helps to stabilize mood and prevent the extreme highs and lows associated with the condition. While lithium is highly effective for many patients and monitoring kidney function closely throughout the course of therapy, in some cases, additional medications may be administered to protect the kidneys or to enhance the excretion of the chemotherapy drugs. For cancer patients, it's essential to work closely with their oncology team to manage the potential side effects of chemotherapy on the kidneys. Regular kidney function tests, such as measuring serum creatinine and GFR, can help detect any early signs of kidney injury, allowing for prompt intervention. By balancing the need for effective cancer treatment with the protection of kidney health, patients can receive the best possible care while minimizing the risks associated with chemotherapy drugs. Lithium is a well-established medication primarily used in the management of bipolar disorder, where it helps to stabilize mood and prevent the extreme highs and lows associated with the condition. While lithium is highly effective for many patients, its long-term use carries significant risks to kidney health, which can lead to serious complications over time. Understanding these risks is crucial for both patients and healthcare providers to ensure that the benefits of lithium are balanced with the need to protect kidney function. One of the major concerns with long-term lithium use is its potential to cause chronic kidney disease, CKD. Lithium can accumulate in the kidneys, where it may cause damage to the renal tubules, the structures responsible for reabsorbing essential substances and managing fluid balance. Over time, this damage can impair the kidney's ability to filter waste products from the blood effectively, leading to a gradual decline in kidney function. In some cases, this can progress to CKD, a condition in which the kidneys lose their ability to perform their essential functions, potentially leading to the need for dialysis or a kidney transplant if the damage becomes severe. Another significant kidney-related side effect of long-term lithium use is nephrogenic diabetes insipidus, NDI. NDI is a disorder in which the kidneys lose their ability to concentrate urine, leading to excessive production of dilute urine and a constant need to urinate. This condition occurs because lithium interferes with the kidney's response to antidiuretic hormone, ADH, which normally helps the body retain water. As a result, patients with NDI experience chronic dehydration, increased thirst, and an imbalance of electrolytes, all of which can further strain the kidneys and exacerbate any existing kidney damage. Patients who are at the highest risk of developing these kidney issues are those who have been on lithium therapy for an extended period, particularly those on high doses. The longer lithium is used, the greater the potential for cumulative damage to the kidneys. Additionally, patients who require high doses of lithium to manage their bipolar disorder are more likely to experience these adverse effects due to the increased concentration of the drug in the kidneys. To mitigate these risks, it is essential for patients on long-term lithium therapy to undergo regular monitoring of their kidney function. This typically includes blood tests to measure serum creatinine and estimated glomerular filtration rate, (eGFR), as well as urine tests to check for any signs of kidney dysfunction. Healthcare providers may also monitor lithium levels in the blood to ensure that they remain within the therapeutic range, as high levels can increase the risk of toxicity and kidney damage. For patients taking lithium, it's important to maintain open communication with their healthcare provider about any potential side effects or concerns regarding kidney health. If kidney function begins to decline, healthcare providers may consider adjusting the lithium dosage, exploring alternative treatments for bipolar disorder, or implementing strategies to protect the kidneys. By staying vigilant and proactive, patients can continue to benefit from lithium's mood stabilizing effects while minimizing the risks to their kidneys. Kidney damage often progresses silently, with few symptoms in the early stages, which is why it's crucial to be aware of the subtle signs that may indicate a problem. Early detection can make a significant difference in managing kidney issues and preventing further complications. One of the first warning signs of kidney damage is a change in urine output. This could manifest as a decrease in the amount of urine you produce, or conversely, an increase, especially if you notice frequent urination at night. You might also observe that your urine is foamy, darker in color, or tinged with blood, which could be indicative of kidney dysfunction. Swelling in the extremities, particularly in the ankles, feet, and hands, is another early sign of kidney problems. This occurs because the kidneys are less able to remove excess fluid from the body, leading to fluid retention and swelling. Fatigue is also a common symptom, as damaged kidneys may struggle to filter out waste and toxins effectively, leading to a buildup of harmful substances in the blood that can cause feelings of tiredness and weakness. Additionally, because the kidneys play a role in producing red blood cells, impaired kidney function can lead to anemia, further contributing to fatigue. High blood pressure is both a cause and a symptom of kidney damage. When the kidneys are not functioning properly, they may fail to regulate blood pressure effectively, leading to hypertension. This increased pressure can then cause further damage to the kidneys, creating a harmful cycle. If you already have high blood pressure and notice it becoming more difficult to control, it could be a sign that your kidneys are being affected. If you experience any of these symptoms, especially if you're on medications known to affect the kidneys, such as NSAIDs, antibiotics, PPIs, diuretics, ACE inhibitors, ARBs, chemotherapy drugs, or lithium, it's important to see a doctor promptly. Early intervention can help manage the underlying condition and protect your kidney health. Your healthcare provider may recommend tests to assess kidney function, such as blood tests to measure creatinine and blood urea nitrogen (BUN) levels, as well as urine tests to check for protein or blood in the urine. Detecting kidney damage early allows for treatment adjustments that can slow or prevent further deterioration, preserving kidney function and overall health. Consulting with your doctor is essential when it comes to protecting your kidneys, particularly if you are taking medications that may pose a risk to kidney health. Regular kidney function tests, such as blood tests to measure creatinine and glomerular filtration rate (GFR), are crucial for monitoring how well your kidneys are working. These tests can detect early signs of kidney damage, allowing for timely intervention before the condition progresses. If you are on medications like NSAIDs, antibiotics, PPIs, diuretics, ACE inhibitors, ARBs, chemotherapy drugs, or lithium, it is especially important to have these tests done regularly. Your doctor can use the results to adjust your treatment plan if necessary, ensuring that your medications do not compromise your kidney health. If you are at risk of kidney damage due to your medication regimen, it's important to discuss alternatives with your healthcare provider. There may be other drugs available that are less harmful to the kidneys, or your doctor might recommend adjusting the dosage or frequency of your current medications. In some cases, lifestyle changes or non-drug therapies may be effective in managing your condition, reducing the need for potentially nephrotoxic medications. Lifestyle changes can play a significant role in supporting kidney health. Maintaining a healthy diet that is low in sodium and rich in fruits, vegetables, and whole grains can help reduce the strain on your kidneys. Staying well hydrated is also important, as it aids the kidneys in filtering waste and toxins from the blood. Additionally, managing blood pressure is critical, as high blood pressure is both a cause and a consequence of kidney damage. Regular exercise, stress management, and, if necessary, medications can help keep your blood pressure within a healthy range, further protecting your kidneys. Medication management is another key aspect of kidney health. It's important to take all medications exactly as prescribed by your healthcare provider. Overuse or misuse of medications can increase the risk of kidney damage, especially with drugs that are processed by the kidneys. Additionally, it's crucial to avoid taking over-the-counter medications without consulting your doctor, as many of these drugs can have harmful effects on the kidneys, especially when used frequently or in high doses. Ultimately, taking an active role in your health is the best way to protect your kidneys. Stay informed about the medications you are taking and their potential risks, and work closely with your healthcare providers to monitor your kidney function. By making informed decisions and following medical advice, you can minimize the risk of kidney damage and ensure that your kidneys remain healthy and functional for years to come. Your proactive approach can make all the difference in maintaining your overall health and well being.